for us. So let me start by sharing my screen here. And let's see. Just to let you guys know, I'm not the greatest with technology, but we'll see if I can get this to work here really quick. Maybe. Oh, yay, it's working. Okay. All right. Hi, everyone. My name is Michelle Lew, and I'm a family nurse practitioner here. And I am here today to really share with you guys my journey of how I became a nurse practitioner and to answer any questions that you guys might have about nursing. I want this to be really casual, so if you do have any questions during the presentation or any comments, feel free to put them in the chat and I will try my best to address them. But to start off, let me tell you a little bit about myself. I've been a family nurse practitioner now for 7 years, and I started out in primary care and then transitioned to urgent care. Since the beginning of the pandemic, we've been adding telehealth services to the urgent care. So it's been really interesting learning how to do medicine over video and not having a patient right in front of you. Prior to becoming a nurse practitioner, I was a registered nurse for 5 years, working in plastic surgery, general surgery, and orthopedic surgery. When I was working in plastic, I did spend a few months working in gastroenterology, but the bulk of my RN experience has really been in surgery. And as you can tell, I started my nursing career out as a nursing assistant, and then I started working as a nurse tech when I was in nursing school, and I can touch a little bit more about those two in a little bit later. But first, I want us to all get really comfortable with each other. So I want to share some fun facts about me with you guys. So first off, I have 6 older brothers, which means I am the youngest and the only girl in the family. And it's really funny because my brother and I, when we were younger, we all aspired to work in the medical field, but I am the only one that actually works in the medical field. All my other brothers are either in like business, finance, or culinary, so far, far away from medicine. And another fact about me is that I immigrated to the US when I was 4 years old with my family. And because we really didn't know anyone here, I had a pretty sheltered childhood. My world pretty much consists of my house, school, and like the local Asian store, and that was probably about it. And because I was so sheltered and I really didn't know anything about the world, I thought my 3 options for when I get older was to either become an engineer, a lawyer, or a doctor. And back then, I thought engineers, you just always worked with computers, and I didn't really have a lot of interest in that. So I kind of crossed that off of my list, which only left a lawyer and a doctor. A lot of the stuff that I know about life, I thought was true on TV. And so the way that TV portrayed lawyers were that they would like represent all these bad guys. They were like full of trauma. And back then I was a really shy kid. And so I didn't think I could do that. So that really only left doctor as my other option. And I was okay with that because as a kid, I was really fascinated about the human body and I really liked taking care of people. So I always thought that being a doctor was going to be the right route for me. With that being said, though, why did I switch from, being a doctor to going into the nursing career? Well, even though I thought I wanted to be a doctor back then, most of the doctors that I did interact with, I felt like they were really intimidating. And I just ended up spending a lot more time with the nurses. And all the nurses that I met, they were so kind, they were so patient. They spent a lot of time with my family explaining things. They would even call our house to follow up with us in a couple of days. So I always thought that was so genuinely nice of them, and they really do care because of that follow-up. And that was really when I decided that I wanted to go into the nursing field. So let's see here. So with that being said, now that I knew that I wanted to go into nursing, I was able to finish a lot of my nursing prereqs when I was doing Running Start. So when I graduated from high school, I actually started applying for nursing programs. And while I was applying and waiting to hear back from these nursing school, I thought that it would be a really good time to get some paid nursing experience. So I became a certified nursing assistant that summer, and I started working in a skilled nursing facility. For those who have any idea of kind of what a skilled nursing facility entails, you work with a lot of residents, more in the geriatric population, and I really enjoy making those friendships. But being the young, naive person that I was, I had a really hard time coping with the death of residents, and I took it really hard. And for a while there, I wasn't sure if nursing was the right field for me because of how poorly I was handling these deaths. But I was like, no, I think I still want to do nursing. So I kind of put that aside. And fortunately, when I got accepted into the nursing program, I decided to dedicate my time and focus more on nursing school. So I left that position. I started nursing school in 2017 in an associated nursing program. And with nursing school, there's typically two programs out there. There's an ADN program and there's a BSN program. The ADN, you get your associate, whereas the BSN, you get your bachelor's. And for the most part, the curriculums are pretty similar. With a bachelor's program, you do concentrate a little bit more on didactic research and paper writing. But with the associate degree program, you do get a lot of clinical and hands-on experience as well to prepare you for the nursing field. I started nursing school, and let me tell you guys something. Nursing school was not what I expected. Before nursing school, I was a really good student. I got straight A's in high school. I got really good grades when I was doing my nursing prereqs. But being in the actual nursing school was completely different. There was just so much reading that was involved, and my instructors weren't able to go over all of that reading material the next day. So I struggled a lot in the first quarter. And by the second quarter, when I was starting to just kind of get used to things, I did have a lot of personal stuff that was going on. And at that time, I felt like it was just the right thing to do to withdraw from nursing school. So I spoke to my dean, and we actually put a hold on my enrollment. And she was super supportive, and she told me, let's just take a quarter off, let you handle your thing, and then come back and talk to me when you're ready, and then we can go from there. Unfortunately, I took about 3 quarters off. So when it was time for me to go back to things, I was given the option to either retest to make sure that I retained the 2 quarters of nursing school that I learned, or I could just start all over again. And at that point, I chose to start all over again. And looking back at it, I think that was a really good decision on my part because I was less stressed out and I was a little bit used to the curriculum already. So I started my nursing program all over again. And after I finished the first quarter, I applied to become a nurse tech. And listening to other people, I think the name nurse tech varies from state to state, but a nurse tech is basically a nursing student whose scope of practice is very similar to a nursing assistant. But because people know that you're a nursing student, you get to be involved in procedures and really interesting that can happen on the floor. And I was a nurse tech on a med-surg floor for the first year. After completing my first year of nursing school, I saw that there was an opening in the operating room for a nurse tech. And so I threw my hat in and I got that spot. So I switched from med-surg over to the operating room, and it was such a different world being in the operating room. I had a blast, and I stayed there until I finished my ADN program. I graduated with my associate degree in 2009, and I took my NCLEX 12 days after graduation, which everyone thought was crazy, but I was the type of person where I had to take the test because I just had all this anxiety building up, and I actually passed on my first try. So it was a really nice time and break after going through all of that. But then I started looking for a job. So at that point, when I was looking for jobs, I really didn't have an area where I wanted to work. From my previous experience, I knew that I didn't want to work with the geriatric population because I didn't think I could deal with loss. And then having been a nurse tech on a med-surg floor, I wasn't really drawn to med-surg. And so I applied to a whole bunch of areas. And one of the offer that I got back was working in an aesthetic outpatient clinic. And you never learn about aesthetics in nursing school, so I was drawn to it. I'm the type of person where I love to learn new things. And so I got to learn about like breast augmentations, tummy tucks. I even learned how to inject Botox and fillers. So I was just really drawn to that area. And so I started working there for 2 years. And when I was a little bit more comfortable in my job and after I settled into it, I started looking at ADN to Msn programs because I wanted to be a nurse practitioner. And I actually found an ADN to BSN. So you could get your bachelor work done and then they'll admit you straight into the master's program to become a nurse practitioner. And it was within my state, so I wouldn't have to pay out-of-state tuition. And it was at a very reputable university. So I didn't think I was going to get in, but I figure, you know, what can I lose if I apply? And I applied and I actually got in. So I started my master's program in 2010. I finished my master's program in 2014, and I started working in community health as my first nurse practitioner job. And as a new grad working in community health, I felt like I didn't get enough support. And because of that, I did burn out after 2 years and started looking for something else. During one of my clinical rotations, when I was in NP school, I was at an urgent care center, and I just loved the variety of things that walked through the door. And so I started applying to nearby urgent care center, and I got accepted into one that was fairly close to my house. And I started working there, and I've been in urgent care ever since. About 2 years ago, I had an itch where I thought I wanted to go back into primary care. So I went back into primary care for a year and realized I didn't want to do primary care. So now I'm back in urgent care, and I plan on staying here for a pretty long time. So why urgent care? What are things about urgent care that I really enjoy? So for me, I love instant gratification. I love the fact that most of the people that I see, they're sick with something, and I have the knowledge to help them feel better within a couple of days, whether that's going over like home remedies, over-the-counter medication, or prescription medication. Like I have the power to like help someone feel better, and for me, like that's such a wonderful feeling. The other thing I love about working in urgent care is the work-life balance that I get. I have 3 toddlers, and so working in urgent care allows me to take them to school. I get to pick them up half of the week, and most of the time I'm home while they're eating dinner. So we can always eat dinner together, and then I get to put them to bed. So I really, really enjoy that. I also don't take my work home. When I was working at the community health, I was taking at least 2 hours of work home every single day just to stay on top of things. And then on the weekends, I had to review labs and documents. So here in urgent care, I don't do any of that at all. Once I'm off, I'm off. I don't have to take call or anything like that. So it just works really well for me. The other thing that I love about urgent care is that I get to do so many procedures here. I get to suture, I get to drain abscess, I get to pop pimples, I get to freeze wart. So it's just a really good variety of seeing acute care, chronic care, and then getting to do hands-on procedure. So I really enjoy that. The other thing that I like about urgent care is that you never know what walks through your door. Like you know, 1 minute you can see a cold or flu, and then the next person you see could have chest pain, and then the next person you see could have like a significant fracture in their leg. So lots of variety, and I really like that. But I also love the fact that it's not crazy unpredictable. So I know that when I go to work, I'm not going to see like a gunshot wound coming into the clinic or someone with a fracture that's sticking out of their leg. Like they're not going to come here, they're going to go to the ER. And I like knowing that I have the ER as a backup support. So if I see a patient for something and I'm a little bit weary about sending them home, and if I feel like they need additional workup, I can always send them to the emergency department. So I like how I have like kind of like this cushion all around me overall. What does a typical day in urgent care looks like? So my clinic opens at 9 a.m. and I try to come to the clinic about 15 minutes before we open, and it just allows me to get ready for the day. So I check my labs, I check my messages and things like that. I work one part of the week, and then I have another nurse practitioner who works the other part of the week. So there's really the only two of us here working the whole clinic overall. And so we answer labs that, you know, each of us orders. And throughout the day, I'll make sure that I'm checking labs and any messages that might be there for me. In terms of patient load, I can see, you know, anywhere from like 8 patients to maybe like 28 patients. It all really depends, and it varies so much. Typically, if we have really nice weather, and we haven't had nice weather in a while, clinic will be a little bit slower compared to like other days. But the patient load can definitely vary. One thing I do have to say about urgent care, one of the downside to urgent care is that we see everyone that walks through our door. So my clinic closes at 7, but for example, if I have a patient that comes in at 6:59, I still have to see that patient, whether it means I'm going to stay until like 7:30 or 8, but I pretty much just stay with them until I'm done with their care, and we can go ahead and close the clinic down. So this right here is kind of like a typical day or things that I see in urgent care. So in terms of illnesses, I see a lot of like colds and flus. I see fevers, cough, pink eye, chest pain, abdominal pain, rashes. In terms of injuries, we see lots of like sprains, abrasions, lacerations, and we also do quite a few work-related injuries, car accidents, burns, animal bites. And then in addition to seeing illnesses and injuries, we also offer wellness exams here, sports physicals, immunizations, and then my urgent care is a COVID collection clinic. And so I see patients with COVID-like symptoms, and I do test for COVID here in this clinic. So if you are interested in working in urgent care, you know, what are some tips to have? It's very different whether you're applying to urgent care as like a registered nurse or a nurse practitioner. And I think for the purpose of this presentation, I'll talk more on tips of what to do if you want to work in an urgent care as a nurse practitioner. With the nurse practitioner, is it possible to start as a new grad? This is one of the most common questions I get, and it definitely is possible. I do recommend that if you are interested in working in urgent care as a brand new grad, apply for urgent care where there's multiple providers. That way you have a point of contact person to go to if you ever see a patient that, you know, you're kind of unsure of. Some urgent care and some organizations will have like a doctor on call that you can call, text, to kind of do a consult, but it's so different from having a live person in the clinic where you can just grab them and be like, hey, I have this rash, can you take a look at it with me? Like, it's completely different, and you feel like you just get more support when you're working with another person in clinic. The other thing too is any experience is very valuable experience. I sometimes get people that work in like primary care, or they work in like dermatology, for example, that are interested in going into urgent care, and they are worried that, you know, this experience that they've had is not going to be suited for urgent care. And I will tell you, any experience you have will be good experience, because we see so many different things here in this clinic. We see kids, we see adults, we see geriatric. So if you've worked with like peds before in the past, your skills in working with the pediatric population will be very valuable in urgent care. So any experience is really good experience. And then I guess one of the other tips that I give a lot to people is that if you are interested in working in urgent care, as a student, you have kind of like this golden opportunity where anybody will kind of take you in. Like, it's easier for you to get your foot through the door, whether that's through shadowing, whether it's through clinical rotations, but just get your foot in the door and let these urgent care know that you exist. So by shadowing or even like doing clinical rotation, you're putting yourself right in the front. People are aware of you. If you're able to make a really good impression, especially with like the managers at these urgent care clinic, when it is time for you to apply for positions there, they'll at least have already met you and know you. And so your odds of getting hired will definitely be higher. So yeah, so that's pretty much a little bit of an outline of kind of like how I got to where I am. I really wanted to save the majority of the time for any questions that you guys might have. So I'm going to go ahead and try to see if I can stop sharing my screen here. All right. So yeah, so I'm going to go ahead. Oh, I can't get back to the thing. Where are you guys? Okay, there you are. All right, so I'm going to save this time just for some Q&A. So if you guys want to unmute yourself or put some questions in the comments, let's go ahead and do it, and I can answer any questions you have. All right, don't be shy, you guys. Feel free to unmute or type anything. It doesn't have to be a question. You can always leave me a comment too. That's perfectly fine.
I have a question. I know you mentioned that you guys did a little bit of virtual stuff in your COVID testing clinic. So when COVID like hit last year, were you guys completely shut down?
So no, we were not shut down. We quickly transitioned from seeing patients in person, and we initially did phone visits while our IT team tried to create a video platform for video visits. So we did telephone visits, we did chat visits too, and then we transitioned over to video visits. But with that being said, we still were being very selective about who we see in clinic. So we were still seeing inpatient. We were seeing patients in person, but typically you'll go through like the chat or the phone or the video option first, just so we can do a quick screening, and then we'll invite you into the clinic if need be.
Gotcha, thank you.
Let's see here. So let's see, Kathy said hi. How is your schedule working with your toddlers? Okay, so my schedule, so I work the second half of the week, and I work every other Wednesdays, and I work every Thursday, Friday, and Saturday. So my kids are in preschool right now, and their preschool starts around 8 o'clock. So I can drop them off at their preschool, and I have enough time to get to work early to kind of set up and everything. And they're in school typically from 8 to 3. And I don't work Mondays, Tuesdays, and every other Wednesday. So I pick them up, and then I can take them to their activities and everything like that. So it's a really nice work-life balance. No, I did not have my kids during school, so I cannot say anything to that. I did have classmates who did have kids when they were in school, but most of their kids, I believe, was kind of like middle school age, so they were able to kind of take care of themselves. So they weren't as dependent as much. And then let's see, is being an NP similar to a PA? Yes, sort of. So being a nurse practitioner, we are trained through the nursing model, and being a PA, you're trained more through the medical model. Now, what's the difference between like the nursing model and the medical model? So I feel like the medical model looks more at treating illnesses, treating what's already there, whereas the nursing model focuses more on prevention and wellness. I will say though, that as medicine has changed over time, I feel like the nursing model and the medical model have kind of like merged together a little bit. So even in the medical model, you still are learning about wellness and prevention. And same thing with the nursing model, you are still learning about disease management and things like that. The other thing that I do want to point out is that as a PA, regardless of what state you're in, you always have to work under a physician. Whereas with being a nurse practitioner, depending on what state that you're in, you could be completely autonomous. I'm in Washington State, and here in Washington State, we are completely autonomous, which means if I wanted to go and open up my own medical clinic, I can definitely do that, and I don't need a physician to back me up or a co-signer or anything like that. And then let's see, being an NP and a PA, I get one of the questions that I get really often is like salary. NPs and PAs, for the most part, you typically make the same amount starting out. You can, any areas where you can work as an NP, you can also work as a PA, and vice versa. I will say though that there are more PAs in surgeries than there are NPs. And that I think is kind of like the only real difference that I see in terms of like the difference between like an NP and a PA. And Kathy, you're an inspiration. Being in FNP school with a 2.5-year-old, I don't know how you could do that. That's awesome. All right. Can NPs switch specialties similar to how PAs can? I know a lot of PAs list that as a big benefit to being a PA. Yes, being an NP, you can switch your specialty. I don't want to say fairly easily, but you definitely have that option to switch specialty. And that's one of the things that I really like about nursing is that I'm interested in urgent care right now, so I'm working in urgent care. 10 years down the road, if I find that I'm more interested in like urology, for example, I can go into urology if I find the right company that will take me. So it's definitely easy to, or I don't want to say easy, but it's definitely possible to switch specialties without requiring any type of like certification or additional training or anything like that. All right, how difficult is it to transfer specialty as an NP? I don't think it's that difficult to transfer specialty. I think it's very similar to a PA transferring specialty. I will say though, within the nurse practitioner umbrella, there's different like specialty that you can do. So for example, there's like a pediatric nurse practitioner where you solely work with just pediatric. There's like an acute care nurse practitioner where you could be a hospitalist and work in the hospital. There's, adult gerontology nurse practitioner where you work with the older population. There's midwives, where you can actually deliver babies and work with pregnant women. So there are those subspecial, or there are those special certification within, being a nurse practitioner. So let's say, so right now I'm a family nurse practitioner. If I decided that, I really am passionate about working with pregnant women and I want to help even like deliver babies, it would be hard to do that from my certification. If that was something that I wanted to do, I would probably go back to school and do one of these certification programs. And typically they're about a year to 18 months, depending on what the program is. And when you come out with that, it's additional training. And so it's just a lot better, and it's also safe for patient care as well. I will mention though, the nice thing about working as a family nurse practitioner is that I can see everyone. I can see babies, I can see toddlers, I can see adults, I can see geriatric. If you have kind of like an age specified certification, so like a pediatric nurse practitioner or an adult gerontology nurse practitioner, you can only work with those populations and you can't work with like any other different populations. See. All right, and if you guys want any clarifications from any of the answers that I'm giving, just let me know here. So Rosemary, hi Rosemary. So you asked about the ASN to MSN program. So first off, I did not know that there was such a program that existed. Once I was settling into my first RN job, I wanted to do like a ADN to a BSN program because I knew that being a nurse practitioner, I had to have a bachelor's degree, and I just randomly stumbled upon this program. And at first, I did not think it was legit, but it came from a very respectable university in my state that had an actual campus. And I talked to the counselor, and it was a brand new program that they just started. So that was how I found out about it. And if you're interested, I graduated from Gonzaga University, which is in Spokane, Washington. I don't know if they're still doing it. I heard a rumor that I think they stopped that program, but I'm not sure. If you already have a bachelor's in a different area and you have your associate in nursing, I know that there are some graduate programs, there are some nurse practitioner programs that will accept that. So you don't need to have a bachelor's in nursing. It's just for me, I didn't have a bachelor's at that time, so I thought I needed one. But if you have a bachelor's in a different area and you have an associate degree in nursing, I believe there are quite a few programs that will accept that as their requirement to go into an NP program. And also good luck with nursing school in January. Kathy wanted to know why I chose ANCC versus AANP. So ANCC is the American, oh gosh, this is so embarrassing. I can't remember what it stands for. It's the American Nursing Credentialing Committee, something like that. So the ANCC is basically an organization that focuses on all areas of nursing. So being a registered nurse, being an NP, it also has additional certification, like if you want to be like an oncology nurse or like a certified OR nurse. Whereas the AANP, which is the American Association of Nurse Practitioner, they focus purely on just nurse practitioner and nurse practitioners only. After I graduated from my NP program, I had the option of applying to take my boards either with the ANCC or the AANP. And back then, and I think they just changed this back in 2019, but back then, the ANCC, I believe, focused a little bit more on like research, leadership skills, whereas the Aanp was more clinical and direct patient care. I applied to take both of those boards because I like to have a backup plan, and it just so happened that the ANCC board was before the Aanp board, and I passed the ANCC board. And I still was going to take the Aanp board, but that morning I woke up and I realized why. I already passed the board. I could work as a nurse practitioner. There's no need to be double board certified. It gives you no advantage at all whatsoever. So I was like, why do I want to stress myself out even more? So I just went back to bed and skipped it. So that's the reason why I am board certified through ANCC versus AANP. Let's see. So Rosemary also wanted to know, as an NP, if I wanted to work with pregnant women and babies, I would need an additional certification. No, Rosemary, not necessarily. As a family nurse practitioner, I can see pregnant women and I can definitely see babies as well. However, if I wanted to specialize more in like OBGYN care and even participate in the birthing experience, then I would go back for like a midwifery certification to do that. But as a family nurse practitioner, I mean, I can see a pregnant woman. When I was working in community health, I actually did some OB care where I saw pregnant women for their routine exam up until I think it was the second trimester, up until like the second trimester, and then I would refer them out to an actual OBGYN so they can know that provider a little bit better since they were going to deliver their babies. So even as a family nurse practitioner, I did some OB care, but not as extensive as if I was like a midwifery, for example. And typically with midwifery, you'll find them either like in their own clinic where it's other midwives, but they would be the people that you would go to if you're pregnant and you plan on having a baby with them. All right. Okay. So I think I answered all the questions here. I do want to give a quick little plug. If anyone does have any questions later on that they think of, or if you want to contact me, I am totally available for any questions or anything like that. You can find me on Instagram. My Instagram handle is at the.np.mom. So find me on Instagram and send me questions if you like. All right.
Awesome. If you guys don't have any more questions, I am going ahead and send the link to the Google form. So if you want a certificate, be sure to click on that and fill it out. It should take you, I would hope, less than 5 minutes, unless your name's really long. And I think that's all that I have.